My name is Nicky and I'm the Adult Services Officer at Clapper.
And I'm Kenny Ardrum, and I'm the Adult Services Coordinator. Together we make up Clapper's Adult Service Delivery Team.
Welcome to this month's Cleft Talk panel discussion, brought to you by Clapper's Adult Services Project, proudly supported by the VTCT Foundation.
Cleft Talk is your opportunity to learn more about the topics that adults born with a cleft across the UK told us are important to them through the Adult Survey and Roadshow.
We hope that you find our panel discussions both entertaining and informative. Remember that you can keep up with the Adult Services Project online, including watching or listening to this and other panel discussions again at www.clapper.com/adultservicesproject. You can also join the conversation on Facebook at www.facebook.com/groups/clapperadults.
This month on the programme, we are discussing a topic that will hopefully be useful to people if they are making one of those important decisions about whether to have further treatment.
Today we hope to provide you with some information so that you feel better informed about decision making and what services you can access.
It is our pleasure to welcome our splendid panel guests, Jess, Hare and David Drake. Can you please start by telling us a bit about yourselves and your background? I'll start with you, Jess.
As you said, my name is Jess Hare and I am one of two clinical psychologists who work in the Cleft Team here in Scotland. My background is that since qualifying as a clinical psychologist, I've only ever worked in Cleft Teams. Obviously I'm in Scotland now, but prior to that I was in the East of England Cleft Service. So that is my background and that's who I am.
So welcome.
Thank you.
I'm David Drake, I'm a consultant cleft and maxillofacial surgeon. I was a consultant in South Wales for the Welsh Cleft Service for 13 years, recently moved to Scotland. I'm also just recently been appointed the head of Cleft Network for Scotland. I'm also a Clapper trustee. Surgically, I do all aspects of cleft surgery in children and in adults, and I've also got an interest in nasal reconstructive surgery and facial deformity surgery, which I do as a max-fac surgeon.
Excellent. Well, I think we're in good hands. A very warm welcome to you both.
Thank you.
Yeah. So we're going to start with the first question. If I'm considering private treatment, will I receive better treatment compared to what is offered through the NHS?
You're looking at me, so I'll answer that one first. So I guess the answer is, from me, would be not necessarily, and I think you need to think about what you mean by better. So I would say that the most common reason people seek private treatment and would see the advantage that many people see is kind of time and accessibility and availability. So many people say that it is they have less waiting lists in terms of private treatment. But I've met people both who've been very happy with treatment they've received privately and people who've been very unhappy. So whilst I have met people who have been very happy with private treatment, not all the time. So it varies from case to case.
I think the key with private treatment is picking the person or team that you're seeing, and I think if you are looking to have treatment for cleft related issues, you need to seek out people who are cleft specialists, and then they should be able to offer you the appropriate treatment. You won't get better treatment seeing somebody privately than you would on the NHS. It's the same clinicians. What the private system often allows you to do is to pick when and where you're seen, and also it negates issues around waiting lists, and they're particularly an issue for adult patients on cleft services. And the reality in the UK at the moment is there are significant waiting lists for adults being treated. So I think some people seek out private treatment to bypass that or to be able to treat it in a way that suits them. But I think the key is to pick your provider, and then you should have a high quality of care.
Sure, and I think we'll talk a bit more about that, because I think that is one of the things that people often do struggle with, is knowing where to turn to or how to know, whether someone's got the relevant experience to be able to help them. I'm going to come to you for this next question, David, but what further treatment generally is available, and what sorts of things might I consider returning to treatment for in adulthood?
Okay, I think adults return to treatment for a variety of reasons. If I covered sort of the main sort of areas of that, I think historically a lot of patients, when they finished their cleft pathway when they became adults, were then sort of told there was nothing more that could be done, or that was the end of it, and that there was no more further treatment available. Particularly patients who are older. If patients who are in their 40s, 50s, definitely were told that. And of course then cleft services didn't exist as the way they do now. I think the key things that patients come back to me and to Cleft Service to see us about are issues around the appearance related to their lip or their nose or their facial appearance. Issues around their teeth, either the appearance of their teeth, or some adults will have things like dental plates that obturate holes in their palates, and as they lose teeth and change as they grow and grow older, then they become an issue, and it's very difficult to find people who can look after those. And some patients return with issues around their speech and things that hadn't been addressed historically or have changed again with age, or their social circumstance. So, for example, I had a grandmother who came because of poor speech, because her grandchildren couldn't understand her when she was on the phone. There's a variety of reasons why people come. And I think any of those issues, and also then the issues around psychology and things as well, patients can return for any of those reasons. They're all valid reasons to return.
Excellent. And just to pick up on that a bit, Jess, obviously from the psychology side, because a number of people watching or listening to this may not be familiar with psychology as part of a Cleft team.
No, absolutely.
And so, yeah, what sorts of things psychologically might someone return for in adulthood?
So, like with all the other answers we've given, there's a wide variety. I would say that something we see very commonly for people is kind of feeling a bit socially anxious, so anxious around other people. Usually that's about other people maybe noticing difference in how somebody looks or how somebody sounds. So lots of people speak to us about issues like that. We also provide a lot of support about decision making in surgery, so if people aren't sure, or other treatment as well, not just surgery, so even for decisions about dentistry, things like that. Sometimes people are presented with options and they're not sure which way to go with them, so we support around that. And actually there are issues that we'll link with other people about, so for some people there's actually quite a lot of interest that we've discovered since we started doing our initial adult appointments here in Scotland in genetics, and people wanting to know about what the chances are of them having a child with a cleft. So there's lots of psychological and social aspects that people return for. And I guess the other big one in terms of psychological support is we speak to a lot of people about what difference it is they're expecting that a surgery or any other kind of treatment will make in their lives, because we want to make sure that somebody's expectations of what the surgery will do for them or the treatment will do for them is in line with what we would expect it to do with them for treatment. So that's another big part of our input on the adult team.
Really important stuff.
I think that's really important, is that what people think can be achieved and what's achievable can often be sometimes different, and I think modern TV and online stuff can often present a very simplistic view of what might be involved. So going through those discussions and having the time to do that. I think the other thing a few patients, adult patients who came to see me in Wales had, was they had questions about their journey, what had happened to them, they hadn't been told. And so sometimes patients come back in their 30s and 40s who just want to know where were they treated, what operations did they have.
Yeah,
So
what kind of cleft did they have? Not everybody knows that.
So I think that's another valid reason, just to come back with questions rather than needing necessarily a treatment. It's just to help us fill in the gaps for them in terms of what's happened to them.
Certainly.
Okay, so this one is for you, Jess. So what advice would you give to a patient who is unsure as to whether or not they want to undergo a further surgical procedure?
So the first advice I'd give to anyone is to absolutely take your time making that decision. Nobody in the Cleft team is going to rush you if you're an adult to make a decision on a particular day or a particular time. All the treatment that will happen if you're returning as an adult will be elective, which means it's up to you, you're electing to do it. So the first and foremost thing to tell people is don't feel like you need to make a decision very quickly. Take all of the time you need. What people tend to find helpful is some people find it helpful to talk to somebody they trust, whether that's someone in their family, whether it's a friend. Some people might want to talk to somebody in the Cleft team, whether that's coming back for further consultation about the treatment. And as I mentioned, that's something that clinical psychologists in Cleft teams are happy to hold an appointment just talking about decision making, and it doesn't have to be just one appointment. These are important decisions, and it's important that you treat it as a significant decision, so don't feel pressured into deciding immediately, would be my biggest piece of advice. And in terms of what will help you make that decision, it varies from person to person. So the same surgery for different people will have different costs that they can see and different benefits. So somebody who's very concerned about an issue might think that risks and costs associated with the procedure are worth it, whereas we see some people who are more on the fence and not sure if they want something, and their decision making may sway to think, well, actually the costs and risks aren't, they kind of outweigh what I think I might get from this. So it's very personal, but take your time, is the biggest piece of advice.
I think the thing I would say about that is as well that sometimes after patients have been with Jess and the psychology team, questions come up that then need to be discussed a bit further with the so there is no time limit or restriction on that, and sometimes it can be several appointments and consultations.
It's a process decision.
And issues come up as part of that discussion that maybe patients hadn't thought about or become more important as when they realise what's involved. So I think having those discussions and over several appointments, sometimes a lot of patients can reach decisions just in one appointment or two appointments. Sometimes it can take a period, and some people need a kind of period just to go away and reflect. And that's not uncommon that patients will say, okay, I'm not sure at the moment, and say we'll come back in 6 months, have a think about things, talk to your family and your friends, and then come back and we can have a further discussion.
It's like decision making about anything really. I think everyone in their lives has made decisions quite quickly to do something and then thought, oh, do I really want to do this? Like buying things. I buy things that seem really good at the time and then I think, why did I do that?
I have a lot of regrets. I look at my wardrobe and think, God, what was I thinking?
And yeah, it's a decision making it's a process just like any other. Take your time.
I think the other thing I would say is write stuff down. I think I always tell patients that when they go home, you have these discussions and things come into your head. They don't feel pressure by us, but it can be an intimidating environment. And then you reflect on things, write them down. And we're never bothered about people coming with lists. It's much better to have those written down. You remember what you want to ask. And lots of people now come. It's on the phone. They've made a set of notes on the phone, and they can show us photographs and things and talk about specific things. The details and just go through that process, and I say that can take 2 or 3 consultations. So.
If you have any questions about it in your head, don't let them go unanswered.
No, absolutely.
Definitely. I think that writing them down is such a good idea, because I know myself, my own healthcare, like, you go away and you think,
it's the second you're out the door.
Why didn't I ask that? But, write them down and come back. So once the person has undergone private treatment, are they still able to get advice and help from the NHS if they choose to go privately?
Okay, I think if they've had private treatment and they have a concern about treatment that's been provided them privately, the first thing they should always do is talk to the people who provided that treatment for them. I think if there is a mixed economy, or potentially a mixed economy, where they have private treatment for one aspect and then return with issues around other areas, and I'm not aware of any cleft service that would turn people away because they sought treatment privately. Patients will have a right to do that. As I say, if other issues come up, it's a very specialist area, and so they may come back and seek advice and treatment for us for other issues, and that's not a problem at all. But if it's specifically related to something that you've had done, you're not happy with it, or you want to talk about it, then you should always first of all return to the clinician. And clinicians who are providing good quality private care will have that built in and that facility built in. So that's normally part of a package of care.
I think what I'd add to that as well is that you will be able to get help and advice from the team, but that doesn't necessarily mean that you will be able to have a treatment to put right what you see as having gone wrong. So there are all kinds of reasons why there might not be further procedures that you can have. So I've had experience with people who've had private treatment and kind of had the idea that it's okay, I'll go to the Cleft Team can sort it out, and there's not always further treatments that can be done in those cases, which is why when we were discussing the kind of policy around private care, we would recommend talking to the Cleft Team first, consulting them who are considering something else, because we don't want people to think that everything can be, you can kind of have things reversed if you're not happy with it, because that's not always the case.
I think also I've seen patients, both cleft patients and non-cleft patients, who sought treatment in the private sector and not been sure about what they've been advised, and have come to speak to me as an NHS consultant about what's been discussed and advice around that as well. And I think that would be another thing to say, if you've been offered treatment and you're not happy or you're not sure, then to get an independent view is a valid thing to do as well. And as I say, and also in terms of if you're not sure about the providers you're seeing, you can ask the Cleft team in terms of what we would think of that, or what might be the issues around that. They can be discussed as well.
Yeah, I know that some people feel it's uncomfortable doing that because they feel like they're talking to us and it will be seen as that they've chosen to go elsewhere. But we're not going to take it personally if somebody speaks to private clinicians. We know there's all sorts of reasons that somebody might go there. We're most interested in people being safe and receiving care that's appropriate for them. So don't feel that we'll take it personally.
Yeah, and I think that's really important. And one of the things that we see from time to time on the Facebook page is that someone may have been told they're ineligible for treatment through the NHS, and they go to a private practitioner which is prepared to do something that the Cleft team wasn't. So I guess people need to be really clear as to why they're being told no, and is it for a medical safety reason, or is it because it falls outside the parameters of what the NHS can provide?
I think that does vary a little bit around the UK, and I think some patients are blocked at accessing care because it's GP fund holding type arrangements. I think the other thing that people sometimes worry about is if they have complications from a private provider, they can struggle to access care from those providers in certain circumstances. And the reality is in the NHS, my NHS practice, I've picked up the pieces of patients who've had aesthetic procedures on their face, and at the end of the day, we are the safety stop for them. And if patients are struggling, they shouldn't be afraid to come and speak to us, and we can advise them about that as well.
So I think you've actually kind of answered the question, so I'm just going to skip ahead one. You're doing good.
Talking too much.
So our understand is that generally these procedures aren't done on the NHS, although there have been a few exceptions. If people are considering going private or either of these procedures, what advice would you give?
Which procedures are those?
Yeah, sorry, I think we
skipped
skimmed over another. One of the that's quite right. One of the procedures that we do here, discussed a lot on the Cleft for Adults Facebook page, are around lip fillers and lip tattooing. Okay. Can you explain sort of what these procedures are for people?
Okay, I'll separate those into two separate
They
things.
are quite separate, and people do lump them together.
So lip fillers you'll see them all the time. 5 years ago, they weren't really a commonly done thing. In the general population, they become very popular and very trendy at the moment. So lots of, particularly teenage girls who've got clefts are asking for lip fillers because all their friends have lip fillers as well. It's not necessarily a cleft-specific thing. But lip fillers are basically a solution that can be injected into the lip. It essentially increases the volume of the lip. And in cleft, we tend to use that for help patients who've got issues with asymmetry or thinness in one part of the lip to address those concerns. As a cleft service, we wouldn't make someone's lip who would look normal looking lip, make it bigger, because that's essentially, they're asking for what their friends are having. But the problem is that patients who've had cleft lips treated are more difficult to put filler into because of the relationship of the scar to the lip. And so therefore it is a kind of specialist area. A lot of cleft services do offer it, and again it varies around the UK. So in Wales, where I was based, we offered it for cleft patients, and we do offer it in Scotland for cleft patients. But in England, I think it varies service to service what's available and in what format and how that would be provided. So I think for any patient who's considering a lip filler or has got concerns about the shape of their lip, then they should speak to the cleft clinicians. They could advise them what's available, and also advise them if they're thinking of seeking out treatment by a non-cleft service person, then they might seek advice whether that's a good idea. And unfortunately, I've had cleft patients who've sought treatment from somebody I wouldn't recommend anybody to go and see, and have had very poor outcomes. The good news in terms of fillers they're designed to be temporary. I would never have a permanent filler in a cleft lip. So most fillers that are being provided are temporary, so they will wear off. So that's the good news. But I think fillers can provide a lot of positives, and also they can allow patients to see what's possible, because then you can move on to using fat grafts to reproduce that effect of a filler. So the fillers allow you to see what's possible. A lot of that is available on the NHS, but they need to ask the cleft teams in their local area what's available and what the issues are around that. But I definitely would not seek lip fillers from people who aren't experienced at working with cleft patients.
And I think that's really valuable advice. That's something we try to reiterate on the Facebook page. But obviously, one thing we do see is that some people have had, they feel they've had quite a favourable experience, and we get concerned about them recommending it to other people. Because
I think something else that I've seen recently is some people who have a cleft palate only and don't have a cleft lip have also said that they've heard that there are lip fillers available to people with a cleft, and that's not the case if you've had a cleft palate only, because unless there's been something with your lip involved in terms of your cleft, that's not related. So if you have a cleft palate only, that's not a service in terms of appearance to do with lips. That would be available to you.
So I think, to reiterate, I think fillers have a lot of positives for cleft patients, and they can achieve very subtle things that I can't achieve all the time surgically. So they're definitely something that we like to use, and they've got very, very specific areas we use them in, but they are a positive. We've used them for years actually, but because they become very popular in the general population, I think people become much more aware of them. In terms of the lip tattooing, that's essentially where that sort of practice came from people having permanent or semi-permanent lip liners and eyeliner put on, and so there are people who specialise in tattooing the lips and the eyelid areas who aren't medical tattooists, and they're in the general population. But part of what they can do is sometimes they can adjust lip lines by using tattooing inks to change the appearance of a lip very subtly. They're not available on the NHS, and I've had a couple of patients who've asked me about that. There are a few medical tattooers who often work within the breast services, because they do a lot of stuff to do with breast reconstruction. But there are none that I'm aware of in the UK, and I've tried to find out before. There are a few tattooists who specialise in those areas. I would go and, if someone's advertising the fact they are specialists in that area, I would go and speak to them and see what they've done, and then check they're regulated in the proper way for any tattooist would be, and there are regulations around that. But I think also I would speak to the cleft service to say what the concern is, and is a tattoo a way that could be addressed, because there may be other options in terms to address that, in terms of sometimes a subtle lip revision under local anaesthetic may address the same issue, and without the sort of issues around tattooing and trying to find someone who can provide that. It is quite difficult to provide. There are a couple of people online who advertise the fact they specialise in that area. I guess through the Facebook page people might find or identify people, but if you're going to have a tattoo, I would view that as having a tattoo in the same way that you would any other tattoo, and make sure they're regulated in the appropriate way.
And I think that feeds really nicely actually into the next sort of question, which is that if you are a patient and are unsure of the credentials and experience of the practitioner, I know it's something we've spoken at length about, is that people don't necessarily know at a glance, like if someone's a health professional when they're calling themselves a practitioner. So how would you recommend people approach the conversation about wanting to see evidence that they're appropriately qualified for what they're doing?
I think ultimately I would encourage people to do that before they arrange to see the people, and I think anybody who is a qualified and appropriate practitioner or clinician will have no issue with you asking that question. They'll probably be quite happy that you did ask that question. But I think it is something that we've spoken about before, is sometimes people will present themselves in a misleading way, and there are certain titles that people can use that don't technically mean they're qualified in that area. So for example, I know that in the policy that was written, we've mentioned about if somebody's called doctor, does not make them a medical doctor, doesn't mean they've had medical training. For example, my title is doctor, but I've had no medical training. I'm a doctor in clinical psychology, and dentists will also be called doctor, whereas confusingly, yourself as a surgeon, once you train as a surgeon, you lose the doctor title and revert to being called Mr. So Dave is not masquerading as a surgeon, he is very much a surgeon. But definitely I would advise that if you found somebody online or through another service, get in touch with their clinic or their team and ask about that. There are certain professions who will have a register. So psychology have the Healthcare Professional Council register, so we will be listed on there. and there are equivalents for nurses and doctors. And do surgeons have their own one, or do you come under the doctors?
We're under the GMC, so the
Yeah.
General Medical Council. So
But yes, I think my general advice would be aware and ask the question of exactly what training that person has had, and also ask exactly how much experience they've had with people with a cleft also, because people may be willing and interested in working with people with a cleft but won't necessarily have had experience in doing so. Do you know if you have any particular things to add to that, Dave?
yeah, I think there's certain things that there are there are three arms to that question. First was someone's basic qualifications, so what are they? And certain people providing surgery would be surgeons, or potentially could be dentists in theory as well, in certain aspects. But in terms of the fillers and things, they can be nurses as well. So you want to know what their basic qualifications are. You want to know what training they've undergone in terms of facial surgery or facial aesthetics, and also then there's cleft specific environments. This could be dentists as well in terms of providing complex crown and bridge work, implant based stuff, all the same questions. And then which regulatory bodies are they affiliated with? So for example, a surgeon would be on the General Medical Council register as a doctor, then also would be normally a fellow of one of the Royal Colleges, and would also be a member of the regulatory body, which is like BAPRAS for a plastic surgeon, British Association of Maxillofacial Surgeons for my association. And then you want to know what their experience are in cleft. And these are all valid questions. And any clinician who is active in the cleft environment and involved with this would happily answer all those questions. And these are things you can check online if you want to check. But I think they're very important. If people don't want to provide those, or they appear uncomfortable when they're asked those questions, then I'd go and find a different clinician. It's that simple, okay? Because I would not feel uncomfortable in any shape or form up people ask me any of those questions. And I guess once if you're positive all of those, then the next question would be, can you tell me how many patients you've treated? These are all questions you should ask any surgeon, is in terms of their experience, and that will vary depending how long someone's been a consultant. But it's that kind of getting a feel for that commitment and interest in treating people affected by cleft, and where that surgeon or clinician is with that. And that could be a speech therapist, a dentist, psychologist, whatever. It's about getting a feel for that.
Absolutely.
And I suppose as a final word of warning, don't be misled by somebody putting lots of strange initials and things in brackets after their name. That doesn't necessarily mean that they'll have done something that's specifically relevant to that area or to cleft.
Excellent.
Some adults may have had treatment a long time ago and not be over familiar with the process for receiving treatment from a cleft team nowadays. Say for instance that I wasn't happy with how my nose looked and wanted a nose job, what would the process be to inquire about having surgery?
That's going to vary a bit per team. For example, in Scotland we do allow people to self-refer, we have a self-referral form. But I suppose the way that lots of people who haven't received care from a cleft team for a long time, or who were told that things would stop when they were an adult, because that was the case when they were growing up, some people find it difficult to find their way back to the cleft team through primary care, so through the GP or their dental practitioner. So actually what we would suggest as being the best way is that we know that on Clapper they have the website of all the cleft teams. So look at which team covers your area and send an email to that team and ask how they get referred, because every team will have slightly different ways that happens, but people often find that a better way to get into the service than going to a GP or a dentist who just needs to happen to know the information about that. But we still in Scotland have people who have been told recently, within the past couple of months by their general dentist, no, you can't have any treatment as an adult with a cleft, and that's actually not true, but may have been true once. So check the Clapper page of the teams would be what we'd recommend to people.
Definitely, and you can get in touch with us as well if people have problems there. We're always happy to help.
I think being proactive, and I think if you contact the cleft team, if you Google cleft team for whichever area you're in, if you're in Liverpool or Manchester, they'll come up and there'll be points of contact.
Yeah, some have fantastic fancy websites, we don't. We will one day.
But if you ring up the person or speak to the person there and say, I'd like to be seen, how do I go about that? And then you're armed with that information that if you go to so a dentist or a doctor can refer you into a cleft team. You can go to your practitioner and say, I'd like to be referred, I've spoken to the team, this is what they need. They say some teams will accept a referral directly in by the patient, others it will just need to come through the clinician. But if you know that, you can overcome a barrier that's the main barrier. Some clinicians won't refer because they don't think you're entitled to or allowed to have access to it as an adult. They think it's a paediatric service. So that's important. The other thing, sometimes if you Google things, you'll come up with team members, like you might come up with me, for example. Well, then if you contacted me or my secretary, then we know the pathway to do that, and that's another way in as well. But you contact the teams either through Clapper or directly through the web, and then we'll be able to advise people what they need to do. But nobody should be declined treatment because they're an adult, or certainly access to the discussions around treatment.
And I would say to anyone who has received the message, however recently, no, there isn't anything in your area that wasn't directly from the Cleft team in your area. Ask the Cleft team again, because they'll be able to give you the definitive answer. Because I think I've known lots of people who've lost faith because they've told by somebody no. Check with the Cleft team.
Definitely. And I deal with quite a few of those queries every week where someone's been told no, and we've gone back to the Cleft team and got a different answer. So, and also being aware that if you move location as well, you're entitled to access a Cleft team in your new location.
Absolutely.
Excellent. I think we've largely covered this, but just for the avoidance of any doubt, so if people are inquiring about having a procedure either in NHS or private practice, can they expect to be informed about the whole procedure, including all the follow-up care?
They should be.
Absolutely. I mean, any consultation for treatment should involve a full explanation of what that treatment involves, and that should be the preoperative workup, and that should be very simple to quite complex. Then what the treatment involves in terms of, being in hospital, local anaesthetic, the whole gambit of what that involves, and then also an outline of what the follow-up would be in terms of, we're going to see you 3 times, you're going to have these dressings, you need those taken, whatever it is, you should be informed of the whole pathway. And good clinicians and good services will do that automatically. But if you feel that you don't understand what the process would be or what's going to happen to me if I have that operation, what will happen afterwards, ask the question. And a good clinician will not have a problem with that. You're not being intrusive or upsetting me. This is the way it's going to be. And for any procedural based or any treatment within Cleft, there will be a follow-up protocol that most teams will have. It will vary team to team. But actually we'll all have our own personal preferences of when we like to see patients and how long we'll do that follow-up for.
Sure.
And I think that is absolutely vital to being able to make an informed decision. You need to have information about the whole of what that treatment involves. Treatment's a process, not just the bit of when the surgery or when the dentistry is happening. There's a whole pathway that should go with every treatment. For some treatments that's going to be relatively short, for others it's going to be longer, but yes, I'd encourage anyone to ask about the whole timeline of what would you be expected to do before and what commitments you're expected to have before, because some treatments might take quite a lot of preparation and appointments before the live bit of the treatment, as people would say. I think a good example is orthognathical jaw surgery. That yes, there is the jaw surgery that happens, but actually there's quite a long pathway and a lot of commitment involved before that point. So when you're thinking about a treatment, you want to be learning about the whole timeline of that treatment. There is no treatment that I can think of that doesn't have any kind of costs in terms of time or some kind of things to bear in mind for the recovery period and guidance you'll need to follow and know about. So if anyone tells you no, there's no costs, no risks at all to this procedure, just ask again, because I can't think of many things where you would literally be able to skip off that day and life would resume as normal.
And I think it's a question that adults often have is how much time is this going to mean off work or university or whatever. It's really important. I think again that notebook and pen, going into appointments with those questions.
And I think most surgeons and teams will be realistic in terms of that, and it will also vary depending on what you do. So if you work in the sort of environment, for example, treated a patient recently who works in a sawmill. Now his time off work is a bit longer than somebody who works in an office because of the environment he's in. So that will vary depending on your personal circumstances as well. But it's important you understand that, and also if you're, for example, if you're self-employed, having 3 weeks off work, there's got a significant financial impact. So in terms of timing and things around surgery, that can be important too. So that's, as Jess said right at the start, this whole picture of how it's going to affect you and your life and what you're doing. It's just not about just a quick procedure. It's about how you recover from it and everything else. So you need to take all that into account.
But I'd say for people to particularly bear in mind, we see lots of people who say that they would like a treatment done by a particular time. I think common things I hear are before university or before starting a new job or for a wedding. Weddings are big ones. And actually, realistically, it's going to be difficult, especially for NHS teams, to be able to guarantee you a time. And we would want to think, if you're thinking that you can only see yourself starting that job or going to that college or getting married if this has been able to happen beforehand, that's something to talk to your psychologist about. And that's not about... that's not going to be us sitting down and thinking there's something wrong with you about that, but it's just that would suggest that your expectations, there's a lot that you're invested in, and you're expecting that treatment will change something significant and concrete and tangible for you. And that's something that we know, having seen people who have had treatment, that they won't necessarily make that overnight difference to your life that you're expecting. So if you are thinking that it needs to be tied in with a particular life event, do talk to us about that, and we will talk to you about the reality of that being able to be able to happen, and also about whether there might be some expectations built in with that we, however talented your surgeon is or anyone else who's providing treatment, there's going to be limitations to everything that can be achieved.
Of course.
I think one of the key problems for adult services across the UK is, as an elective non-emergency procedure, accessing beds and resources is difficult. And I think that was true where I was in Wales, it's true in Scotland.
Yep.
Adult services, there's a long waiting list for, once treatment has been decided, there's still a long waiting list for that. And I think that's a problem across the board.
Yeah.
All the surgical procedures we talked about and you think about for adults should be available on the NHS, but access to those resources and access to beds and theatres to do them is difficult at the moment across the UK. But again, the teams will be able to inform you about that, and they'll be honest. If you say how long am I going to have to wait, realistically, they'll tell you. They'll be able to put a time frame on that for you, and then it's your decision how that fits in with what you want or require.
Yeah. If at any time you have second thoughts about your treatment, are you able to change your mind?
Absolutely.
Yes.
Okay.
Please do.
Anything that you have as a treatment, almost any surgery you have as an adult, as a cleft patient, is an elective thing. It's your choice. You've chosen to talk about it, you're worried about it, and you want to have it done. If you then change your mind, you're not going to upset or affect yourself adversely. So that's not a problem at all. And again, that would be just come back and talk to us. And there's not normally any time pressure to treat any of these things. If you treated it in a year's time or 2 years' time, it wouldn't make any difference to the outcome as an adult. So it doesn't matter if you want to wait. I think there's an old phrase: "If in doubt, do nout." So if you're not sure, give yourself some thinking time rather than diving in one way or the other. And you certainly shouldn't feel under any pressure by any clinician. If you're being put under pressure by a clinician to have a treatment, you're seeing the wrong clinician. Okay, and I would never put anybody under any pressure. It's always your decision. And if you then change your mind, if you change your mind not to have surgery and then came back 6 months later and said, actually, I've really thought about it and I would like to pursue that, that's fine too. So that works both ways. But don't ever be shy about voicing a concern, or if you don't want to have something done, always say. I think there are some complex treatments, particularly related to dental implants and then complex restorative work, and also the jaw moving surgery, the orthognathic surgery, that requires quite a lot of complex workup. So once you commit into that pathway, you're then changing yourself in preparation for something that's going to be done, and so therefore that's a decision you have to really think about. So the time to, but even if you then were halfway into that preparation and said, actually I can't go through with this, it might be difficult to undo it, but it still wouldn't. We'd still recognise and respect that, and so it's always your decision. It's your body, so it's not an emergency thing you have to have done. Otherwise, you're not going to be well. This is something that you're doing. You've got valid reasons for doing it, but you can change your mind at any time. That's not a problem either.
Yeah, we want people to make informed decisions that are the right thing for them, and you, as the person accessing the service, are the only person who can know whether it's right for you. We can say what's available and say from like a clinical perspective whether we think it could benefit you, but it's going to be subjective whether it's the right procedure for you or whether it's the right time. So we do see people who at a certain time have been told an option and they thought no, not now, but then things might change. It might be due to different life circumstances, like finding yourself with a bit more free time, but we are more than happy. We would encourage people, in fact, to change their minds if they're having reservations. And as we said earlier, if that's about feeling like you need more information, please ask for it first. Don't sit there quietly on a waiting list, worrying about something, thinking you'll only find out the answer once you've had it done. Come forward and ask us. I think we'd all feel happy as a team to know that people are coming forward with questions or saying that they changed their mind. We don't want people sitting there worrying about it quietly and not getting in touch.
Absolutely not. And you both touched on in this discussion as well, the complexities around orthognathic surgery in particular, and sort of the workup around that. And we do have an entire panel discussion dedicated to that coming up in November as well, because it is a big commitment on people's parts.
Yes.
No, absolutely.
It is, and it's something that I know that as we've been saying, all of these things are elective. I've met lots of people who either themselves or their families were told that at a point in time that it didn't sound optional. That is optional. I'm sure you'll be covering that in November. But if you were ever told that as an adult you would have to have something, just check with your team why it was that you had to have it, because in most cases that shouldn't be true.
No, that leads nicely actually into this next question, which we see a lot on the Facebook page as well, where people get themselves a little bit stuck because there often can be a scenario where people are told different things from different people, which obviously makes it very confusing to make a decision. And those people could be different clinicians with different views, but it could be family, it could be friends, it could be other people influencing someone's decision making. So what would you recommend people do if they really don't know what to do?
If they really don't know what to do, I think it's just responding to something in that question. I think many people expect medicine to be more black and white than it is, in terms of yes, something can be done or no, it can't. And actually, in any healthcare profession, there's going to be certain kind of shades of grey within that, where there are going to be subjective calls that clinicians will be making about whether they think something's right or not. So if you're hearing differing opinions from people, it doesn't mean that somebody's right and somebody's wrong. The answers just aren't always that black and white. Again, if you're really stuck, you're really not sure what you want to do, write down questions that we've been saying. What more information do you feel would be relevant to you to try and help you make that decision? What is it that you're not sure about? Speak to the people that you trust. Please do arrange an appointment to talk to the psychologist in your team just about decision making. We are very happy to do that. I think I know certainly in our service information leaflet in Scotland, but I'm sure this applies elsewhere. That's one of the things we list as something that we support with, is decision making. It's a big decision. So if you really don't know, remember that there's no pressure. You don't have to know everything right now. You don't have to decide right now. And think about who you would, if it would be helpful for you to talk to somebody else, whether that's friends, family, the psychologist, or if it's just finding out more from the members of the team.
Definitely, just kind of that general acknowledgement that making these decisions is hard as well. They're not decisions that most people have to make, and so acknowledging that even that process is quite a thing to go through.
I don't know, actually, David, it might be that you would be able to tell all of us why is it that two different surgeons might say differing things.
I think most surgeons recognise that cleft is a complex area. It's a very specialised area. And in a lot of surgery, there's often more than one way to approach a problem, and which also sometimes will achieve slightly different things. And so, if you see two clinicians with the same problem, you may get slightly different answers in terms of the way to address that. Doesn't mean either of those are wrong. It just means there's more than one approach, and a surgeon's approach is based on their experience, the people who train them, the people who've influenced them. There's lots of things that come into play, and also their experience of what they can achieve with the techniques that they use. And as a surgeon, I've been a consultant almost 15 years. What I do is evolve by things that I've done that have worked, some things that haven't worked so well. And if you saw another surgeon, they may get good results with a thing that doesn't work so well for me. So you'll get a different picture. I've seen patients who've seen 2 or 3 clinicians and have come to me for an opinion on those 3 options. And a good clinician should be able to put those into perspective. And it may be also the impact it has on you in terms of what that would achieve and what that would involve in terms of some treatments could be simpler, some could be more complex, and some surgeons prefer simpler approaches, some like more complex approaches. There's lots of I think talking to a surgeon about what the options are, what they can achieve, and it's often compromised. There's not a pure, that will achieve everything for you. This might give you those three things. This technique might give you those three things. Which one do you think would suit you better, or is going to address what you're worried about more? That's developing a conversation relationship to understand what a patient is wanting from treatment and what I can deliver doing different things. And actually sometimes I'll say to patients, you've got three options here. It's like a menu from very simple, which is it actually can include doing nothing, all the way up to quite complex treatments. So how do those sound to you? And these are the impacts on those for those different things. Which one do you think would fit best with you? And you can go away and think about those and come back. If you get other opinions from surgeons, you may get even more approaches coming to the mix, which as you said, can be quite confusing. Even for surgeons, we could sit if you get 4 surgeons in a room with the same problem, and all have different ways of treating it. Doesn't mean any of those are wrong. They could probably all achieve if they're all experts in that area, would achieve nice results, but they're just different ways of going at it. It's like I guess in a way looking at a car and thinking which way do you want to drive it? What do you want to, everybody has slightly different approaches, but all reach the same point in the end.
I think it can be anxiety provoking for people if they come expecting to get a solid answer, to be told yes or no. The kind of expert health professional model, you need this. This will fix your problem, and I think that's a word that we hear a lot as well. People say this problem needs to be fixed, and actually it's only a problem if it feels like a problem to you, and any treatment is going to be an attempt to address that problem that you're raising rather than the solution to a concrete problem. So yes, expect some fuzzy different options, a variety, a menu of options in some cases. You're more likely to get that than a straightforward yes, we should do this is the right thing.
I think you can often improve things, but you can't always address everything. And I think that's me being realistic, and I think it's important that patients understand that as well, because that's about expectations. So as I say, I'd love to be able to achieve 100% result so that the patients are every time I do an operation or a procedure, but I can't, and no one can. But we'll do our best to achieve what we can. But sometimes I know that there'll be limitations relating to previous surgeries or scarring, or there's some issues that come into play. And it's my job to explain those to a patient so they understand what we can achieve.
And the kind of comparison I often use, which puts it into perspective with some people quite nicely, is that it's like if you've ever gone to a hairdresser's with a picture of someone like, if I went with Cheryl Cole's hair and said, make me look like this, there's only so much people can do with the different kind of things that people have about them. Everything's individual, and anyone who can say, yes, I can make you look exactly like that picture, can they really? I'm not sure they could, and I'm not sure they could without me having to subscribe to daily blow dries and things. So if you've ever gone to a hairdresser and not quite come out with the picture that you had in mind, the same thing can happen with this kind of treatment as well.
Of course.
Okay, and last question. So if this discussion has got some people thinking that they would maybe like to get in touch with the Cleft team, how can they make an appointment?
Look up Tatler's list of Cleft teams.
Yeah.
Find who is in your area. If you're not sure which of 2 teams is in your area, send an email to both of them. They'll be able to tell you. I think it's usually postcodes that decide which, if you're near a border of certain places, it's easy for us. If you're in Scotland, you're with us. But yes, look at that list of teams and send an email or give them a call.
Excellent.
I think the other thing I would say, part of that is if you're seeking out private treatment, then be very careful with who you're seeing. And again, speak to your local Cleft teams if you found a clinician or provider online, or you've been to see somebody and you're not sure. Speak to your local Cleft teams in the same way. But I think the first port of call, whichever route you want to go, is speak to your local Cleft teams. You better get advice on all of that.
Absolutely, absolutely, really important stuff. Well, thank you both. That's all we've got time for on the panel discussion this month. We hope that you at home have found this discussion to be useful and interesting.
Remember that you can access more information and listen again to this and other panel discussions on our website at www.clapper.com/adult-services-project.
And if this discussion has made you wish to want to follow up about your own treatment, as we were mentioning before, please, you can contact your GP and request a referral to the Cleft team, or have a look at the details of your local Cleft team on our website, which is on screen now.
We'd like to thank our panellists, Jess, Hare and David Drake from the Scotland team for joining us for today's discussion, as well as a big thank you to you at home for joining us.
Yes, thank you very much to you both. And make sure to join us again next month when we'll be in Bristol discussing kissing, sex and intimacy. Sounds interesting. You'll want to make sure to bring your notepad to that one.
Absolutely.
Bye for now.
Hey guys, thanks for tuning in. We want to know what you thought of the programme so that we can make it even better for the next one.
So go ahead and give the video podcast a like, and if you're watching the video, comment below. Let us know what you think. If this was interesting, make sure you subscribe to our podcast and videos.
Our next podcast and video is coming out at the end of the month. So check out www.catwell.com/panel discussions to find out what we'll be talking about next. You can also watch this and other panel discussions again on our website.
We want your questions to take to the panel. Visit our panel discussion page on our website to submit your questions.
You can also check out everything we're up to with the Adult Services Project, including a list of our upcoming programmes and events at www.kappa.com/Adult Services Project.
And make sure to also follow us on Twitter and Facebook. We look forward to seeing you again soon. Bye for now.
Bye!